President Obama and the Congress, and even our friends across the street in the counter-protest, are for the bill that would have you believe that people are dying in the streets. They want you to believe that if we do not support this bill, that we have evil souls and want people to die. Understand this. Every one of the doctors here, every one, sees patients without insurance. In fact, were it not for the altruism of physicians, patients really would be dying in the streets. Ladies and gentlemen, we are at a crossroads in America. We face a giant government takeover of our healthcare way of life that will, not might, will fundamentally change how we, the patients, will be treated.
This is all being done under the pretext of fixing our healthcare system. Let me tell you something, it isn't broken, so don't fix it. I think you can look right around you at the medical complexes here in Huntsville and tell that the system doesn't need to be fixed. Now, can it be improved? Of course it can, and we are constantly working on ways to do so. I've been a doctor for over 30 years, and I resent being told that my life's chosen work has been in a broken system. That's an insult to every healthcare worker in America. I also resent being accused of making decisions more for my own financial gain than for the benefits of my patients. As also was previously mentioned, our president seems to think that pediatricians only recommend tonsillectomies for financial gain. Thirdly, I resent the continual implication that I'm a crook of some sort. There are all these assertions that there are hundreds of billions of dollars that are fraudulently billed for Medicaid or Medicare services. And supposedly, much of the cost of this new healthcare system will be paid for by eliminating these fraudulent claims. If there is fraud in the current system, I think you would be much more likely to find it by looking in Washington, D.C. than by looking at the nation's healthcare workers. Doctors will lose the freedom to treat their patients as they deem most appropriate based on the individual facts pertinent to the problem that afflicts each patient. There will be numerous commissions formed to issue rules and regulations that must be followed. These will be enforced by appointed administrators who are responsible to no one. Another cost of this bill is that you will have restrictions on your right to choose what, if any, health insurance you wish to purchase for yourself and your family. Many people will be forced into the government plan because their employers will find it financially beneficial. Other people will be forced into the government plan by several mechanisms outlined in these bills. And even if you can afford health care insurance, you will have to limit your insurance to whatever the government says is appropriate, or else you will have to pay a large tax on your premiums because you have what they consider as excessive benefits. Also, you will lose the right to not have health care insurance. There are possibly reasons that you might decide you don't want or need health care insurance. Under Pelosi Care, that could cost you your personal freedom by being put in jail for up to 5 years.
Unfortunately, we are seeing a tremendous intrusion into government health care. This new House Bill 3962 squarely places the government between the patient and their physician. This bill could result in as many as 60 new directives on what health insurers will offer. The government option will result in a dramatic decrease in the type and number of diagnostic exams a caregiver can provide and order. Now, I can tell you personally, as a radiologist that reads 8,000 to 10,000 mammograms a year, that I find at least 15 to 20 cases between 40 and 49 years of age of breast cancer that caught early. So these sisters, daughters, and wives are still with us because they haven't been thrown under the bus by bureaucrats who are looking at our outcomes. Well, mammography is a tough thing, but we're guided on the principle of trying to preserve and save lives. So yes, we have to occasionally do extra tests. There is what these bureaucrats call excessive waste. They're not there trying to figure out, well, is this a cyst, or is this a sclerosing adenosis, or is this cancer early? It takes time, it takes judgment, and it does take money. But it's money well spent.
It's got some nice feel-good language in it, right? This is section 2531, pages 1431 of the bill, that promises to give money to the states that create alternatives to medical liability litigation. Well, gosh, that sounds nice, doesn't it? The very next sentence says, but if a state is not eligible for this money, if they put any law in the bill that limits attorney's fees or puts a limits on damages. Golly. So what's the federal government doing? They're taking our money at bayonet point and say, well, we'll give it back to you if you do what we tell you. Is that what the government's there for? Doesn't sound like it to me. That ain't what I voted for, at least. Well, why would they outlaw tort reform in their bill? Oh, thank you. Win the prize. The top contributors to the Obama presidential campaign was the legal industry. Gosh, imagine that. $43 million to the Obama campaign from lawyers. Greater than 80% of the money given to Congress was by lawyers, and the vast majority of that was the plaintiffs' lawyers. But let's see, $22 million of that went to liberal Democrats. Imagine that. Howard Dean, a Democrat himself, in a town hall meeting stated one time that there was no tort reform in either the House or the Senate bills, and this is a quote, because the people who wrote it did not want to take on the trial lawyers, and that's the plain and simple truth, unquote. Gosh, they're really representing us well up there, aren't they? You know, the liberals say that there's a moral imperative to take care of people that are less fortunate. But they wouldn't say it was moral of me to come up and put a gun at your head and say, you got to pay for my mother's health care. They wouldn't say that. Yet, they vote for somebody else to come put a gun to your head and say, you got to pay for their mother's health care. This country is based on freedom, not guarantees. But with freedom comes responsibility. Responsibility for yourself. It is not the government's job to take over health care or drive private companies out of business. And there is no constitutional authority for the federal government to pass any legislation whatsoever which would provide health care to anyone. It's not in the Constitution, folks. I would say that we're in the midst of a Cold War right now against our very freedom and our way of life. We've had hot wars in the past, and now we're in the midst of a Cold War within our own country. So what will our generation be remembered for? Will we be the generation that orchestrated the demise of the American dream, who by our quiet acquiescence allowed a few pseudo-intellectual socialist Marxists to control our futures, our health, and our very lives? Or will we be remembered as the patriots who remembered the sacrifices of patriots before us and, like them, stood up against tyranny